Hi, everyone. Thank you so much for being with us today. I wanted to give everyone an opportunity to introduce themselves. My name is Tess Karenbauer. I am the Public Relations and Marketing Associate at CEDAC.
And my name is Suzanne Morris. I'm a vice president at O'Neill and Associates, and I work with the folks at CEDAC.
Hello, my name is Katie Provencher, and I'm the Chief Executive Officer and Principal at Housing Opportunities Unlimited, otherwise known as HOU.
Hi, my name is Hannagh Jacobsen. I'm the Strategic Project Director of Housing Opportunities Unlimited, HOU.
Great. So Housing Opportunities Unlimited, or HOU, works with large-scale affordable housing developments that need relocation services, and they have developed expertise in safely relocating people during the pandemic. We're here today to learn from them about that experience. So first, can you give us a brief rundown of Housing Opportunities Unlimited and your relationship in the community development sector?
Of course. Thanks, Tess. So Housing Opportunities Unlimited is over 40 years old. We have our foundings here in Boston and provide national relocation services to nonprofits and for-profits, housing authorities across the country, and we specialize in temporary relocation and resident in place and permanent relocation. And we have the honor to work with many people in our community development sector that we're all involved in here in Boston and across the country.
Thanks, Katie. So it seems like relocations are moving forward during the COVID-19 crisis, at least in some states. What are the logistical challenges that you've faced, and how is HOU addressing them?
Yeah, I'll let Hannah's been really involved in this, so I'll let her kick us off.
Yeah, so in all honesty, we're not COVID-19 experts, but we're every day strategizing with our contractors, our clients, our property management and resident services teams to figure out what we can do to keep everyone safe through construction. And the biggest logistical challenge is usually around space, especially at some of our more urban developments where we're doing construction work. And the space starts in the apartments where different contractors are usually on top of each other, trying to get work done as fast as they can so a resident can return, all the way to negotiating a community room space that normally we would have residents go to if construction was too noisy, and now we need to separate that out to enable 6 feet of social distancing.
Yeah, and I would add a lot of cleaning, a lot of moving, and things taking longer and costing more than we're used to.
Right.
Yeah.
So HOU is managing a process with a lot of different elements: HOU staff, residents, third-party vendors, and so forth. How have you gone about managing these different groups to keep people healthy and safe?
A lot of communication. We always have a lot of communication, but now more than ever, all being on the same page and understanding what the plan is. And it's one thing to have a plan, but then for everyone to be set up for success to implement it. HOU has worked with a international healthcare consultant who's helped us develop the response plan. Because as Hannah said, we're not health expert or COVID-19 experts, but constantly want to make sure that we're keeping residents, staff, and clients and vendors safe. So a lot of communication, phone calls that are usually 20 minutes are now taking an hour and a half. 10 moves that could be done in a day are now 5 moves in a day because everyone needs to be on the same page and implement. Hannah, I don't know if you'd add anything to that.
No, that about covers it. And then just kind of a lot of different processes and procedures we're seeing. We have places where contractors are creating their own COVID-19 safety officers. So in places like that, we're able to, go with whatever the most aggressive plan is. But just, a lot of procedures.
So what advice would you give to any affordable housing developer or property management company who is contemplating this kind of major relocation?
To be thoughtful, to take time to come up with a good plan, not to sound redundant. Things are going to take, again, more time than they used to, but it's worth it to make sure you have a plan and that you're keeping people safe. I think that's sort of, and make sure you're getting all the people on your team together, the general contractor, the client, the owner, the relocation company, the subs, just really make sure that you're all working together.
Yeah, and I would just add being conscious of how much extra time and money is going to go into it. As Katie said earlier, so, usually a contractor could finish an apartment by 5 p.m. Someone can be back for dinner, but now you have to add on the cleaning and understanding that piece.
Yeah, and I think just I also just really thinking creatively. I think this work can still happen. We just need to be creative. We had a call with a client yesterday who's trying to utilize some community room space and is sort of taping out sections for a family to sort of make sure that they're staying apart from another family, and just really being creative and working together.
Mhm.
And what are the keys to keeping everyone safe during a relocation during this pandemic?
Um, a lot of it is what you hear a lot is washing your hands and social distance, wearing PPE. Those things come to mind around really, really thinking through safety. Hannah, would you add anything?
I think it's also equipping residents. I think it's pretty easy to tell a resident, you need to practice social distancing, but really laying out to them how that looks, giving them the tools that they need for the day, whether or not they are hanging out in a community room, how are they going to get lunch, or can they go stay with friends and family? I think really just setting up a day plan for residents so that they can follow it too, just like you would for a contractor or whoever else is involved.
We've talked a little bit about this already, but besides HOU, the residents and the contractors, who are the key players in putting together a safe and efficient relocation process?
Yeah, I would.
Are there any additional ones?
Yeah, so Suzanne, I would definitely add at the top, and where the buy-in needs to be is with the owner and the developer of the property. Those groups you're naming can put together the best laid plans, but if there's not the support from the top, and it's been very interesting to see, we're on a national scale, it's been very interesting to see owners acting differently, sometimes sort of cringing about what they're thinking, and then sometimes just really impressed around the thought that's going in. So definitely need that buy-in at the top. And then all of your subs, right? Like we've talked through, I want to make sure HOU employees are safe and residents are safe. And then had some folks being like, yeah, and the movers and the cleaners, right? Like we want to make sure we're all safe and have all the resources that we need to try to be as safe as possible. And unfortunately, we had a call this morning with a very thoughtful owner and developer in the Boston area. And we're going to sort of be moving into relocation over the next month or two. And I think they've been as thoughtful as possible. I don't think it's perfect. I don't think it can be perfect, right?
Yeah.
We don't even have a vaccine for COVID-19.
Right.
But I think if we can all say that we've had a plan, that we're current on our guidelines and the CDC thinking around local and state and national guidelines, and if something happens, which obviously is unfortunate, we don't want to, at least we really have done the best we could do at that point.
Is there anything else that you would like to add at this time?
I would say a general trend we've seen is a lot of folks who are doing resident in place, meaning they have contractors going in for the day, doing some work while the family goes out for the day and the family returns at the end of the day. I don't want to say impossible right now, but it's pretty difficult. I think out of probably 70 active sites we have, Hannah, correct me if I'm wrong, I think we have one that's maybe sort of considering still trying to do this. A lot of folks who had initially thought we're going to do this day work with the family going in and going out is now safely and thoughtfully moving that family out into a vacant unit for a few days completely while that work is done, and then moving them back in. So we've had a number of folks moving in that direction.
Yeah, and I would just add, it just depends on how extensive the work is too. If you're just going in, maybe you just need to access one room in a residence apartment for one day, right? That's going to look your COVID-19 plan is going to look very different than if you need to access their apartment 10 days in a row in all rooms. So just really understanding, and I think we've had all of our clients, their contractors are really doing tough work trying to figure out how to make their campaign shorter for that reason, and also how to keep their contractors safe. So I think a lot of this is going into their careful planning too, and we're just trying to support it from our end.
So it sounds like flexibility, creativity, and sort of thoughtful planning and time management are sort of the keys to a really successful relocation during this time.
Yep, and it's doable. It's taken us, the HOU's COVID-19 response document that I mentioned we developed with a healthcare provider is, upwards of 30 pages right now and has 15 pages of attachments. a lot of time was put in, but it's really doable, and we're able to now take this plan and break it into how we can implement and getting this to our subs and getting this to our staff. So I don't think that it doesn't have to happen. I just think we need to be thoughtful and, to your point, Suzanne, creative around this right now.
Great. Well, thank you everyone for joining us today. And we really appreciate all of the time and effort that you're putting into keeping your staff and residents safe and healthy during these unprecedented times. And we do hope that this plan can also serve as a model to other providers out there in the affordable housing field. So again, we appreciate your time and we wish you all of the very best.
Thank you, Tess and Suzanne, for having us on today. Appreciate it.
So much.
Thank you.